All right, today we're putting on our detective hats. We're going to hunt down a condition that's a total classic on medical exams. It likes to hide behind something as simple as fatigue, but oh, it leaves behind some really strange clues. So let's solve the case of the missing factor.
So, imagine this case file lands on your desk. What are we looking at? A bunch of really strange clues, right? The patient feels incredibly weak, sure, but that's just the beginning. They've also got this sore, super red tongue and that awful pins and needles feeling in their hands and feet. You know, on their own, you might think, what is going on here? But when you put them all together, they start pointing to one very specific culprit. So, how do we start cracking this case? Well, clinicians know there's something to look for. It's called the classic triad. Think of it as a signature pattern, a group of 3 distinct symptom types that basically scream the name of our culprit.
Okay, so what makes up this triad? First, you've got your general anemia symptoms, the weakness, the fatigue, the paleness. Classic stuff. Second, the GI symptoms. And you've got to remember this one. It's a huge clue for exams. A smooth, sore, beefy red tongue, that's glossitis. But the third piece of the puzzle, that's the real kicker. It's the neurological symptoms, that numbness and tingling. These 3 things together, that's the foundation of our entire case.
All right, we've gathered our initial clues. Now the investigation is going to get a little more internal. We're moving from just looking at the symptoms to what's happening on a microscopic level. To really get what's going on, we have to find the root cause. And it all comes down to a key player that has just vanished. Think of it like a missing VIP escort. And there it is, our number 1 suspect, pernicious anemia. Now, what is that exactly? It's a type of megaloblastic anemia, which is just a fancy way of saying the red blood cells are way too big. And the whole thing, the entire case, hinges on not having enough of one specific protein, intrinsic factor. Yep, that's our missing escort we've been looking for.
So how does this whole mess happen? Well, it all kicks off with an autoimmune attack. The body's own immune system literally starts attacking these special parietal cells in the stomach lining. And why does that matter? Because those are the cells that make intrinsic factor. So once they're gone, IF production just stops. Now, here's the deal. Vitamin B12 is a total VIP. It can't get absorbed without its personal escort, intrinsic factor. No escort, no entry. It's that simple. And the result of all this? The red blood cells can't develop correctly. They end up huge, fragile, and basically useless. And that, right there, is your anemia.
Okay, let's circle back to that classic triad of symptoms for a second. Look, all 3 are super important, but one of them is the absolute giveaway. It's the one thing that screams pernicious anemia and not some other kind. And you'll want to pay attention here because this is a classic trick on exams. And here it is, the dead giveaway. It's the neurological symptoms. Think about it. Someone with regular old iron deficiency anemia, yeah, they'll be tired, they'll be pale, but they will never have that numbness, that tingling, or problems with their balance. So if you ever see anemia symptoms paired with neurological issues, boom, your brain should immediately jump to a possible vitamin B12 deficiency. So we've got our prime suspect lined up. Now it's time to get the hard evidence to back it up. We're going to need a few specific lab tests to get the proof we need to officially close this case. And when the lab results come back, they paint a crystal clear picture. You run a CBC, a complete blood count, and what do you see? Low hemoglobin, but a high MCV. That confirms you've got those big macrocytic cells. A serum B12 test? Well, duh, it's going to be low. But the real smoking gun, the thing that proves it, is the test for intrinsic factor antibodies. If that's positive, you've confirmed the autoimmune attack. And just to top it all off, a gastric analysis will show something called achlorhydria, basically no stomach acid. Because, get this, the same cells that make intrinsic factor also make hydrochloric acid. It all fits together perfectly.
Okay, the evidence is in and it's overwhelming. All signs point straight to pernicious anemia. So, case solved. Now we move on to the verdict and the sentencing, which in the medical world means a very specific and lifelong treatment plan. Now, this next part is absolutely crucial to understand for managing this condition. The root of the problem is absorption. It's not that the patient isn't eating B12, it's that their stomach is physically unable to absorb it. So giving them B12 pills? Totally useless. It's like trying to deliver mail to a house that doesn't even have a mailbox. The letter's never going to get inside. So, what's the solution? Well, the only way to treat this is to completely bypass that broken absorption system. And we do that with injections of cyanocobalamin, that's just vitamin B12.
At first, the schedule is pretty intense, with daily or weekly shots to build their B12 stores back up. But after that initial phase, they're going to need monthly injections for the rest of their life. This isn't a temporary fix, it's a lifelong mandate. Okay, so we have the diagnosis, we have the treatment plan, great. But what does this actually look like day to day on the front lines of patient care? This is where nursing management isn't just important, it's absolutely critical for keeping the patient safe and making sure they have a good quality of life. Everything we do from a nursing perspective comes directly from the symptoms. Remember the ataxia, that poor balance? That means safety is priority number one. We have to be all over fall prevention. That sore, beefy tongue? That needs gentle, careful oral hygiene. And this one is huge. Because of the numbness in their hands and feet, they might not feel heat correctly. We have to teach them to stay away from things like heating pads, because they could get a serious burn and not even realize it. And of course, education is everything. The patient has to understand, truly understand that this is lifelong, and they need to learn how to give themselves those monthly shots. So, the patient's on their lifelong treatment plan, their symptoms are under control. It feels like we can finally close the case file, right? Well, not so fast. With this condition, there's one last twist in the story. A hidden danger that means we have to keep monitoring them for the rest of their lives. Any guesses what it could be? And this is where the true long-term seriousness of this condition really hits home. It turns out that the same chronic damage to the stomach that caused the pernicious anemia in the first place, well, it also puts these patients at a much higher risk of developing gastric cancer. So even when the anemia is totally managed, the case is never really closed. Lifelong vigilance is an absolute must, which makes you realize this was never just a case of a missing factor. It's a condition that demands our attention for a lifetime.